The number of patients diagnosed with high blood pressure or hypertension has increased since the start of the pandemic. Health experts say even young people in their 20s or 30s should be cautious. Jeong Eun-joo zooms in on this phenomenon.
This 40-year-old man has been diagnosed with high blood pressure or hypertension during a medical checkup 2 years ago. As he wasn't overweight, he hadn't been worried about his blood pressure, a major cause of hypertension.
When I visited the clinic and measured my blood pressure, it was around 150. I immediately started taking medicine because it was too high to control through only diet or exercise.
The number of hypertension patients has increased since the COVID-19 pandemic. The proportion of adults aged 30 or over diagnosed with hypertension rose from 19.4% in 2019 to 20% last year. Only about 20% of hypertension patients in their 20s and 30s respectively recognized that they had high blood pressure. That's a significantly lower figure compared to the awareness rate of all adult hypertension patients, which is 70%. It has been found that hypertension patients in their 20s and 30s do not receive proper care in a timely manner, and only 11% are treated with antihypertensive drugs. The risk of cardiovascular disease increases by 1.6 times if hypertension patients don't take medication while controlling their diet.
Even if you're young, if you've suddenly gained weight, get headaches, feel general weakness, blush easily, or feel changes in your body, it's advised to get a blood pressure test. Young people also eat out more frequently, so should be cautious of increased sodium intake.
Experts advise consuming only 5 grams of salt per day. Since most foods contain 2 grams of salt, consuming 1 gram of salt per meal is an easy way to calculate sodium intake.
Whether it's salt or soy sauce, think of it as 1 gram of salt for one side dish. Try to then eat 2 or 3 other side dishes without seasoning. Alternate eating between the unseasoned dishes and seasoned dishes.
Exercising regularly is also necessary to prevent obesity, which increases the risk of high blood pressure. Experts recommend 30 to 60 minutes of moderate intensity physical activity at least 5 times a week. Jeong Eun-joo, Arirang News.